Well, good evening, Dr. Barry. It is so nice to have you back over here and to be hanging out with you and the psych nerds. How have you been doing?
Doing good. Can't believe it's already August, but yes.
I know. Flying by this year is flying by. Well, your name has been flying around my chat room. Speaking of, oh, wait, let me turn this down real quick. Hold on, I got the other one going. Because of this case right here, and everybody's like, we need Dr. Barry on the sofa over here to talk about this. So, as we were discussing, I sent you some questions. You've been hanging out in the chat some. I have so many questions, but I want you to kind of just start off and just, you just give like your insight, and we can just let those unfold as we go, if that's cool with you.
Yes. Today we'll be talking about the Lindsay Clancy trial. And what's at the center of this trial is, did she understand the difference between right and wrong? Did she understand that she was doing a crime at the time of the incident? A lot of people have compared this case to Andrea Yates or some other cases. And a person can have a mental health diagnosis, or a person can be psychotic and not meet the legal standard for insanity. That the legal standard for insanity is very, very high, that the person does not understand that what they're doing is wrong. I have not made up my decision yet. And any thoughts or things that I share here, it's meant to be for education only. Only Lindsay and the people that evaluated her, they're the only ones that truly know what happened, what's going on. And so I'm just sharing things based on what we've seen and heard so far.
Awesome. I appreciate that. And I'm the same as you. I'm just taking everything in day by day as we watch it, examining every little piece and asking why, over and over and over. And so I guess one thing, like one of the biggest things to start off with is the terminologies that they're using, like, oh, it was postpartum and then it was the depression and then postpartum psychosis. Can you speak on in general terms, like what these look like in different situations or how they might present in somebody? Because that's one thing that's very murky with me. I have no clue what that looks like and some of the signs and whatnot.
So, postpartum depression goes beyond just the normal baby blues. That sometimes a person, after they have a child, it can be normal for that to be a major adjustment, for there to be anxiety, for there to be things that come up. But for some people, they suffer. It is significant, where they have significant postpartum depression, or they have postpartum anxiety, and there is a severe condition called postpartum psychosis. With Lindsay Clancy, it doesn't sound like there was any psychosis prior to starting the mental health medications, that she was struggling with the transition back to work. And that's when some of the sadness and some of the depression and some of the anxiety, all of that kind of came up around that point. And to me, because the defense keeps asking questions about how SSRIs, so selective serotonin reuptake inhibitors, how SSRIs, that class of medication, can trigger mania or hypomanic behavior. That was something that the defense turned an expert that the state called, and they asked her about the impact, how SSRIs can sometimes trigger mania in somebody that we don't know might have a history of bipolar disorder in their family. Because up until this point, to my knowledge, Lindsay Clancy was never diagnosed with bipolar disorder. And that particular psychiatrist said that somebody with that diagnosis, yes, they can be prescribed an SSRI, but you would have to have something protective on top of it to make sure that you don't induce mania.
Interesting, very interesting. And I want to ask you about some of the like the medication list and things like that. And one thing you just mentioned that I want to ask real quick is this dynamic of this. So during the act that she was carrying out, what she did to the children herself, the 14-second phone call that was placed. I see this mentioned a lot in the comment sections of, well, they called, and you see it with the defense and whatnot, and or the state, and nothing was wrong with her. She made these, the CVS order and called them, and he called during this. Can you speak to like those type things where it's this interpretation I see of, well, she acted normal here, so therefore?
And a person can come in and out of psychosis, and yet the state will say that even if a person that the coming out of it, that you would have realized what you did, because in those 14 seconds she didn't stop, she didn't call for help, she didn't do any of those things, but she was able. Patrick Clancy, he said she sounded like she was in the middle of something. And Psychosis, that doctor um, that testified, I want to say it was yesterday, but she did a great job also explaining that psychosis can be hearing things that other people don't hear, seeing things other people don't see. It can be delusions, paranoia, that those are some of the things that can encompass psychosis. And we haven't heard exactly, because I think what the defense has alluded to is that there was a man that told her to do the act, that it was a command auditory hallucination. And I don't know if she's going to say that had ever happened before that point, because it sounds like she was struggling with thoughts of harming the children even before that auditory hallucination. So that's it. It's just it gets really muddy. And somebody asked on my channel, asked me to talk about malingering. So malingering is where a person clinically in treatment. So somebody could come into me and they might be trying to get a certain diagnosis for legal purposes or for custody or related to maybe to qualify for some benefits or something. So it's faking a disorder in order to get some secondary gain. There can also be an aspect of a person over reporting symptoms because it's a cry for help. So I work with a lot of people that have chronic pain, and they'll often say if they tell the doctor their pain is a 9 out of 10, or like that sometimes they can't always say how much pain they're in because the doctors won't believe them, that they'll start getting negative thoughts about, like, oh, you're just trying to get a certain medication or something. And so it can be similar in mental health, where sometimes a person can just be so desperate to want help, and they desperately want help, that sometimes some symptoms may be overreported, but in a forensic setting, so in the legal setting, that a person after a crime might, I'm not saying this is what she's doing, but we're saying this can happen, like when, oh, I know her name, she attempted to say she had multiple personalities. It was Letitia Stout, that she tried to say, oh, I had multiple personalities. And a similar thing of like, how could you have been in a constant state of psychosis, doing all of these drops, and your daughter never noticed there was anything wrong with you? So a person can come in and out of psychosis, and yet there doesn't seem like there was anything that stopped this plan. And I really want to hear from the people that saw her. Sometimes a person can think that that like their children are evil, or that like this is the only thing they can do to save their children. And so there can sometimes be like a religious thing that can go along with it. And we don't have any evidence that that's what's happening here in this case.
Now, on that right there, where you just mentioned that, because that's another thing of the religious component that we usually see. And that's, for me, just being a casual observer of trials and whatnot and everything. And in my mind, I'm like, yeah, you usually have this kind of like religious type situation to it. Do you feel like because there isn't that with this, it's just like she heard this kind of almost random command hallucination, that could hurt her defense or her side of the story?
But the thing that I think helps her, and I see in the chat, and I completely agree, Lindsay Clancy's case is nothing like Letitia Stout, because she wasn't like Lindsay was crying for help. It seems like she knew there was something going on. She felt like her brain was like there was something wrong, and she was trying to get help. And it's sad that the state views that as like her manipulating her providers. Like that's because it does sound like she was desperate for help. And yet, um, I just with this case, um, I think it's going to come down to what those experts that treated her are going to say. What was said? What was the treatment plan? I personally would love to know if she followed up with any type of counseling during this time. So I like to use this platform to also educate people that medication alone, that often if somebody is having severe depression, if they have severe anxiety, medication alone might not be enough. And those medication checkups with the psychiatrist are sometimes 10-15 minutes. Sometimes they are very, very quick, and sometimes following up with a counselor that that can help with how do we deal with these intrusive thoughts, how do we keep everybody safe, how do we do all of that, that can often be helpful.
Hmm. And could you speak to now maybe that like treatment plan or the medication list and all that that she had? Because that's another huge thing of all the medications. We see kind of the back and forth of the state presenting she wasn't taking the pills, she wasn't doing this, blah, 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 blah. And then the defense is like, well, her doctors changed the medications and they asked Patrick to do this, to get rid of whatever the bottles. And so that's why these are here. And to me, that all equals out. But of course, just being somebody who's, I've taken some of these medications before in the past and whatnot. So I know like, oh, you have to let this, take a while unless something really bad happens in the first week or whatever. I have a very limited experience on them because so could you speak on that and how many there were and stacking them and all that stuff?
So it sounds like from the very first medication, her insomnia got worse. And that I don't think I didn't really hear talk about her having insomnia. And that's where I think the defense is alluding that that first medication might have induced mania. Because I think the first medication might have, I think it was Zoloft, and then the second one was Prozac. And those are both SSRIs. And if it is inducing mania, then you would need to like have the person's system you have to add a mood stabilizer, and a lot of people are asking why didn't this happen on an inpatient unit, like why wasn't she just in a hospital for 2 or 3 months? She would have had to agree to to do that. Like you can't hospitalize somebody against their will. And she might have thought we can manage this on an outpatient basis. And there have been cases where a parent has called the cops on themselves because in that moment they got really strong thoughts, and they were overwhelmed, and they were afraid that they might do something to harm their children. And so if somebody ever is having intrusive thoughts about harming themselves or others, 988 is a crisis hotline. You can always call the non-emergency line. Sometimes the non-emergency line is a little different from 911, but both are going to have like there's going to be a response, reaching out to friends and family. Because I think there was a myth of her being high functioning, because even Patrick was like, she seemed okay. But I think there was an internal struggle that nobody else really saw. And that's where even somebody that's high functioning can still have like severe depression, can have really dark moments.
That's really, yeah, that makes a lot of sense. And on that, when they were talking about her journal entries, pardon me, and the state, of course, is like, well, look at these right here. That's basically, I'm, stressed out with the kids and, I'm over them or whatever. And then the defense meaning, read out passages of, she sounded like, I'm excited to go back to work. Maybe I'm feeling better. I want to get better. I'm really, it was very, it felt truthful. I'm not sure the quite right word I'm looking for, but somebody
Right.
who
It
was
was
wanting
it was
help.
it was more balanced than I think the excerpts that the state read. Yeah.
Yeah, and so what did you make, or what do you make of like the things that we've seen so far in regard to her charting all of her stuff, like her own medications? Because I was really impressed by that, where I was like, wow, she really was like, I felt this way on this date, and these are the thoughts. It really, to me, showed a pattern of, okay, this isn't just something that came up at the last minute. Like, let me scribble a bunch of stuff down.
I think part of that might have been her nursing experience as well. that nurses are often very detail oriented, and she needs to communicate that information clearly to her doctors. And it can be hard to remember that on this day at this time, this was the side effect or symptom that I had. And I do think that some of those entries are going to be used against her. And that's where I tell my clients, if they're having a journal, I sometimes have them do like a good thoughts journal and then to not write down all the bad thoughts, because unless if you write them down, like tear them up or something, because them just sitting, like I wouldn't want the wrong person to find those thoughts. But I tell them, never write, if you're having thoughts of hurting yourself or hurting somebody else, you need that does not go in the journal. Like you need to call or text me. You need to, like, we have a crisis plan in place for that.
Now, on that note, a couple of things. I
Mhm.
saw somebody ask a question a minute ago
Mhm.
about how much do you think insurance can play a factor in some of these situations as far as like maybe cost prohibit in the way of one of the things that they're having in their civil lawsuit is they're like, well, the doctors will only see her for a few minutes and this and that and blah 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 blah. Do you think that that can be a deterrent in somebody getting treatment?
So I've also heard some people say that sometimes psychiatrists just, and I'm not saying this is about all psychiatrists. In my experience, 8 of the 10 psychiatrists I've met normally rush through, like you feel like a number, you know what I mean? Versus with the psychiatric nurse practitioners I've worked with, they often connect, like, and I have worked with some really good psychiatrists, but sometimes a psychiatric nurse practitioner sometimes gives you a little bit more time. Psychiatrists are trained in how to do therapy, but therapy pays less than a med check. So often the majority of their schedule is often medication checks, and they normally recommend outpatient therapy. So I would love to hear the providers talk about the things that they were recommending, and what kind of happened with that. And with insurance, I have worked with people that get the care they can afford and not the care they need. So I've worked with people where I thought they needed an inpatient stay, but their insurance denied it, or they weren't approved for an inpatient stay. In this case, I don't know if there was anything that was denied. Like, and that's why the state pointed out that she checked herself out early from that hospitalization in January, that and it wasn't because insurance wasn't paying or any of those things. I think the state pointed that out on purpose.
That makes total sense. Now, also, when you were talking about not writing certain things down and whatnot, so on that right there, what are your thoughts on her possibly underreporting some things? A couple of reasons. Number one, she's in the profession that she's in, but also possibly the fear of like, I don't want to say XYZ to a professional for fear of getting children taken away or so, like a repercussion. I know she told her husband and I
Mhm.
think her mother, I'm having thoughts of harming the children, but it didn't seem to go beyond like okay, almost like okay, I feel better now type situation. But that to me would be like a scary thing to be like, I'm going to go tell my doctor or whoever.
And often the doctor would focus on safety. And the safety could be either that the person needs to go for an inpatient stabilization, or the person is not left alone with the children. And I don't know that her doctors knew that she was having command auditory hallucinations. And I'm not sure if she's going to say that was the first day and time that had happened. I don't I d- we don't have that information yet.
Interesting. Interesting. And kind of just circling back to some things and whatnot, like some of the testimony and everything. Well, today we saw a lot of like the crime scene, the blood testimony, so on and so forth. The window situation, the things she did to herself and whatnot. To me, it really almost looks like and I don't want to say rushed, but it's like something happened and then triggered I want to take myself out. Like I don't see a pre-planned part to it. By her stuff, like by her, we haven't gotten to the Google searches yet. I know she did look up a couple of things, but I have not seen. Here's a person who extracted her phone and they're putting them up here so we can see point blank, this is what was on there. So I get that. And I guess that's one thing when I go back and forth with, okay, so was this psychosis and not guilty by reason of insanity, or was this? Because there's so much, there's such a big why behind it. Like, okay, with the state's version, and I guess there's not a good answer to that, right?
Mhm.
But so much of it doesn't make sense because I'm like, he said it was the best day she had. He's gonna run to the store. He felt good leaving her, and then like bam, just something flips. And can just anything trigger that? Could you just be doing whatever and like chemically something just switches in you?
So the red flag I saw. So this is a public service announcement for anybody that has a loved one that has significant, if they're having thoughts of harming themselves, if all of a sudden they get very happy out of nowhere. And because in hearing his testimony, when he said that day seemed like a really good day, that was because sometimes the person does have a plan, not always, and that hasn't come because that's just more general in looking at working with people that have thoughts of harming themselves, and looking at that literature, that sometimes there will be right before an attempt, there will be this improvement in mood that comes out of nowhere, but it's because the person has a plan to not be here. And so that's where, um and I don't know that that type of testimony would come in, but clinically, because I've worked with people and studied people that want to do that to themselves, and there's a specific word for it, but YouTube doesn't like it, because with a person in that much pain, you focus on relieving the pain. So if she came to my office for therapy, it would first be validating, you are in pain. I see you. This must be so hard. What can we do to make this better? It's like, I don't want to ask my husband for help. Let's ask him for help. I need you to ask him for help. Like the first thing we want to help them build a life they want to live. And in my experience, I don't know about her, but sometimes people in helping professions are the worst at getting help. And I know there's going to be a question about if she thought reporting significant mental health would impact her job. So, when you're in active psychosis, of course, they're not going to want you to be a nurse. But if you get it under control, so individuals, there are lots of people that are nurses that have bipolar disorder, ADHD. Schizophrenia is a little bit harder because sometimes the medications can sometimes impact the way a person thinks, but there are people with serious mental health diagnoses that are managed. I just renewed my liability insurance today, and in renewing my professional insurance, it asked, are do you have a mental health condition that's impacting your ability to do your job? And if I said yes, then I would, like you can't. So if I was in active psychosis, I couldn't be a therapist. But once I was stable, I would be able to continue to be a therapist. So it's not a forever thing. It's if you're not stable, you have to get stable, and then once you're stable, um, some people, because some of that is protected by um because they can't fire you for a disability. So if a person was fired and they got stable, and they had disability insurance, and they had resources available to them to get stable, sometimes they could have a potential claim against their employer for because there are certain things that are protected.
Now, let me ask you this, and okay, so I saw this somewhere, so I'm not 100% sure if I'm being accurate, but I felt like I was reading somewhere, and help me out, chat here as well, where Lindsay originally wanted to plead guilty, like almost like I'm going to plead guilty to what I did to the kids. And then we're going to have a separate trial situation for the mental thing. But Mass, when it let her do that, it was like, no, you have to combine it. And so that's kind of why we're here. Now, today, when we saw her stipulate to a bunch of like they didn't tell us exactly the particulars of it or whatever, but to a bunch of the things.
It's just that like that person, the chain of custody with the lab, because the judge read through some of it, and it's basically because the state was painstakingly like going through, and but understandably, because they do have to make sure that everything is entered appropriately, or else if somebody's providing testimony and the foundation hasn't been laid, the defense can bring that up on appeal. So yeah, stipulation, yeah.
And Emily asked a minute ago how static is psychosis? Like, is it just like how does that work?
So every person's different. So, and psychosis can be a part of multiple different diagnoses. So a person can have schizophrenia, and that's where often with schizophrenia, the person is in an active state of psychosis for an extended period of time. There is some psychosis that can come with severe depression. So, major depression with psychotic features, and a person may come in and out of it, but each person is going to be different. There can also be bipolar disorder with that's severe with psychosis, and there can also be medication side effects. So I've heard of lots of people. There's a whole side of TikTok about people talking about hallucinating on Ambien, like, well, but like the things they did, like that they ate a bunch of food, or like the weird things people did while they were on certain sleep medications. And so sometimes there can be side effects with medication, because they talked about her being in a state of delirium coming out of surgery. And I think the state really wants that to be like it was just surgery, but could it have been that other psychosis too? We don't know. Mental health is a little guessy, I'm sorry. Like it's not like a this is always the same. Like for every single person that ever has this diagnosis, it's going to look exactly like this. It really depends on the person. I've also heard people talk about that there are tests that they can do that won't say exactly what medication will be right for you, but sometimes the test can genetically look at, okay, with your genetics, we don't recommend these medications, or like this is the class. If the person is needing this class of medication based on your genetics, this is what's recommended. Often those tests are not covered by insurance. But if she had been, because she had been on 13 medications in the span of like 4 months. So I would have fought to get some type of testing approved, because it seemed like they were guessing, if that makes, but psychiatry can be a little, and I'm not a psychiatrist, but they just kept throwing more meds at the symptoms and not getting to the root of what's causing this, in my opinion, my personal thoughts.
Now, you might have already said this, but I was kind of looking over the little question things again, so I'm gonna just ask again. And it's what's the difference? Well, hold on.
Mhm.
What's the difference between being bipolar and psychotic?
Okay, so a person can, bipolar disorder has different severities. So a person can be hypomanic. So there's bipolar 2. There's a cyclothymia where a person cycles through different moods. And then there is bipolar 1, where a person can have states of intense mania, and then they often have depression. Not every person with bipolar disorder will experience psychosis, but there are some. There are some people that in either a manic or a depressive state, they may experience psychosis. So that's where the person believes I can fly. Like that's like a manic delusion. Like the person believes that they can literally fly, or they believe that they're the president. That sometimes a person's mania can get so big and grandiose that they can sometimes have delusions. And mood stabilizers are antipsychotics, like the antipsychotic medication. She was on Seroquel and some others. She was on a ton of medications. She was only prescribed 2 or 3 at a time, so she was never prescribed like 5, but still, she was on a lot of medications.
Now, real quick, hello asked a pretty interesting question, and she asked you, what do you think about her not denying the homicide? She didn't fight that. Basically, she knows what she did now, but not in that moment. Like, what are your thoughts of that?
Can you repeat it one more time? I got distracted.
I know you're all good. So it says, Dr. Berry, what do you think about her not denying what she did to the children? She didn't fight that. She knows what she did now, but not in that moment.
And it's not that she didn't know what she did in the moment. I don't think she's arguing that. I think she's arguing a voice told me to do it. So she's not arguing that she was dissociated or that she was disconnected or that she blacked out and she doesn't remember. Because I've worked with people that have experienced blackouts during a bipolar episode, but they would be so disconnected from reality that like the person might not sound normal or typical. Like they would present different during that time. Um, and so it's not an either or of either bipolar or psychotic. There can be some psychosis within bipolar disorder, but we're also talking about postpartum psychosis. And so like I need some mental health experts to talk about what it was she was experiencing. And they might just be saying postpartum psychosis because these symptoms came on after she had a child, but I would be concerned, did some of these medications make her worse? And that's where Dr. Yosef was on Josh Ritter's channel recently. And he had a really great video just talking about how sometimes a person can have a negative reaction to the first medication. And sometimes you need to let the system settle and like clear that medication completely because most except for there's only a certain class that goes in and out the body fast. SSRIs take a while to get in your system and they take a while to get out. That's why when you first start on a dose of Zoloft or something, the doctor often wants a person to stay on it for a period of time because you're often not going to feel anything at first. If you feel something, there is something called like a placebo effect. Like sometimes just taking a pill for my anxiety, I feel a little bit better because I'm taking something. But normally to feel the real effects of it, it's going to take time. But side effects can sometimes come very, very quickly. So that's why doctors will say, and those medications do have what they call a black box warning, that in some people, those medications can increase thoughts of harming themselves.
Now, let me ask you this. And I know this is different for everybody, so this is just kind of like a whatever question. Is there anything about her talking about a voice told me to do it, a man's voice, whatever, that sounds like suspicious to you? Or
Um, I I don't know that that symptom was ever. So I want to hear from her prior providers if that was ever reported during that time, and then was it ever when was it first reported to somebody? And sometimes a person is experiencing psychosis and they don't say anything, so that is completely possible, where they're embarrassed, they don't want to look like a bad, I don't, like, sometimes a person doesn't say anything. So I'm not saying that it's impossible. The state's theory is that she didn't mention it until after talking with her lawyer. That's the state's theory. I still need to hear from the person that treated her. And then also if the state has a mental health expert too. I don't know if they have somebody that says that yes, she is criminally responsible. We assessed her, we gave her these tests, we went through everything, and what she said does not meet criteria based on our opinion. I want to hear both sides.
yeah, I'm very curious once like the state rests their case, whatever, to see what the defense puts on. I mean, I'm just like, okay, bring it on, because I just feel like it's going to be a whole secondary trial.
And it's my understanding that they have two really good experts because I think they have somebody, I've heard that they literally wrote the book about postpartum depression. And so I've heard they have two really good experts. They tried to get a third in there, but it was happened too late and they weren't able to get that expert. I think the judge didn't allow that went in. And earlier you mentioned what I thought about her just wanting to stipulate or just like wanting the state not allowing her to just plead guilty and just proceed with a penalty phase. I don't know if the state thought that might look like her taking responsibility for it. Do you know what I mean? I don't know. The state's been a little, the lawyers yelling at each other, it triggers me. It's like they sometimes the defense and prosecution, they have started yelling at each other, and I'm like, the kids, settle down. Ah. And the judge is doing a good job staying in, like, hey, y'all, like, stop that. And okay, I let them go, and his sidebar. Let's take a
At the
sidebar.
sidebar. That's my like my verbal tick word from this trial is sidebar.
Mm.
Okay, now let me ask you this. So let's move to the hospital. So she's, the situations happen. They've rushed her to the hospital. All that they do all the things. So one of the things is correct me if I'm wrong, y'all. I felt like Patrick said that she called him, like he spoke to her 3 days later or something of this nature. I can't remember when, but she never mentioned the children, and she basically just told him what she went through. Now he's saying that she talked about the voice at that time, which I think
Okay.
will be very pivotal for the defense. Um, because that's, whatever. Now I could see looking at both sides, I could see the jury say, well, that's their husband. Of course, he's going to say that, whatever. But he's saying that for right now. What is your take on the whole thing of what she didn't mention the kids?
And there could be multiple reasons for that. One reason could be a person being in denial about, like, not fully accepting what they did. And I don't think she expected to survive that situation. You know what I mean? Like, I don't think she expected to survive it. I think it could have jurors thinking, like, is this the way the state is claiming it to be? Like, if she was just thinking about a lawyer and thinking about, her injuries and not asking about the children. And yet there could be another piece of it that's just like she couldn't even fully accept or consider. So denial is a part of grief. Like, that's one of the first stages. Like, that sometimes you don't really accept the fact that they're not here. Um uh but I don't I I'm interested to hear what she told the people that met with her about. Now she's broken up, like, she's been crying during the trial and all of that. um I would have expected there to possibly be more emotion after she survived about the children, and there didn't seem to be.
Yeah, and looking at her sitting there, and of course I'm looking at it through, a computer screen and side view. And the first few days she really had her hair down, and now she's been more like, her hair's back, she's pretending she's face forward, whatever. She looks number one completely different when you look at the pictures they show of her like prior to or whatever. And she just kind of looks like a shell of a person, just like this vacantness or whatever, which is kind of what I would expect. Um let
If
me
she
ask you this, and this is, of course, probably different for every single state, and I don't even know off the top of my head what it is for mass. Um, and this is on the notion of, say she gets not guilty by reason of insanity, the sentence that goes along with it. I think like anxiety that I see in a lot of comment sections and whatnot is she's going to quote get away with it. Like she could potentially walk out the door in X amount of time, whatever. How does that work? Is it like they can sentence her to it? And again, it might be different from state to state, but can you give any insight into what that looks like?
Most states, the person ends up going to the state hospital and they're assessed at the state hospital. If they are convicted of not, or if they're found not guilty by reason of insanity, chances of them not staying a minimum of 5 years is like slim to none, because that state hospital is going to be responsible for saying when they're able to be released. And that's a whole process. That's hearings. Like, it's a whole process. Emily asked, and I wonder about this too, if she's medicated right now. If she was diagnosed with something like bipolar disorder or something, antipsychotics like or the mood stabilizers can sometimes just kind of flatten, where the person doesn't feel high, but they don't feel high highs, but they also don't feel low lows. You just kind of feel blah in the middle. And so we don't know what her current medications are. We will hear from her current treating providers. I think the defense will likely call somebody to talk about the medication she's currently on, if she has been participating in any type of therapy. Because when somebody pleads not guilty by reason of insanity, their HIPAA related to their mental health goes out because everything related to their mental health comes in for the state and for the defense to possibly use, because they're using their mental health as a defense. So all of that is going to come into play.
Fascinating. Yeah, I will be very interested to hear about the current thing. Yeah, because there's two versions of this. Like, of course, I want to know what's going on now. And like, what would my reaction be if it was something really simple or something really extreme? There'd be two different things, obviously. And I mean, I'm with you where so much of this is going to be a battle of the experts when they get on the stand. We're going to really see the defense. You think you've been seeing some sparks fly now? Oh, it's gonna go down. We have a thing in my chat room where when any one of the state's witnesses get up there and say that those wounds are superficial, the S word triggers. I'm like, they don't know what they're going out to go pick your switch because it's gonna happen right now. You can't say that word to this guy.
And I guess because medically, because I even saw those, and I was like, I personally wouldn't call that superficial, but I'm a psychologist and not. So I work with people that sometimes. So I've worked with people that engage, that have had like an attempt, and if it's like a scratch, then I consider that to be superficial. Something that breaks a significant amount of skin, but that's more from like a mental health side and not medical. So from a medical side, they have a definition of what they feel is superficial. But these jurors, these are just normal people. And they might look at those and be like, that is not, they might be like, they might be like the defense and say, that is not superficial. Like that was, to me, I think she made a credible, like I think she made a serious attempt. I wouldn't call that like a minor. She was just trying to get attention. She knew she would survive. I don't see it that way. And the state playing it that way could make them lose credibility with the jury. So them just so two things can be true at the same time. A person can have a mental illness and be responsible for their behavior. And so that's where the state just being like, she was fine, she was manipulating, like the state doing all of that. I'm just like, y'all could concede that, yeah, she was struggling. Being a mom is hard, and murder's still wrong. Like they like, you know what I mean? Like she knew to send, like the state could turn this in a different way, but they're not. Really.
That's such an excellent assessment of that because I really feel like the way you just described it is with the state. Because that's what brings up so many questions of why to me. It's the way they're presenting it,
Yeah.
and it's like they're not acknowledging, even though they say, "Yeah, we're not denying that she had these, issues over here," but they're almost trying to make it out like it was this whole fake thing, and it's just like if they leaned heavier into that dynamic of look, because I'm with you, like when I looked at the pictures, well, at first I was like, the neck one, I was like, "Oh, I thought that would be worse." The arm one, I'm kind of like, "Ew, like that looks bad." I feel like that my overall interpretation, again, I have no credentials, so this is just sofa opinion. To me, what it looks like is she was in this mode of like, oh my gosh, like whatever, I'm taking my life. Let me do these pills. That's going to take too long. Okay, let me do this knife. And then that human instinct kicked
Yeah.
in of
Yeah.
like, oh, I can't do
Right.
it.
Yeah.
And then it was like, okay, well, let me go out the window. And then it was like, oh, but it's going to hurt, the whole
Yeah.
thing. And it just feels like human instinct for survival took over and she just
Right.
couldn't quite get there with any of these things.
And that doesn't like because that's yeah, because that's just weird that the state it's just it's very strange. The state's perspective is very difficult. I also just want to go back briefly, side quest, about so if somebody is found not guilty by reason of insanity, if for some reason they are released at some point, there are conditions. So they have to often, they're court ordered to take their medication, they're court ordered to participate in therapy. If for any reason they don't abide by the court's requirements, they can be placed back in the hospital. And so, not guilty by reason of insanity, it's not this like cushy thing. um, I wonder how the prison, because she is never going to walk again. Like she has chronic injuries. It's my understanding. I heard somewhere that she requires two nurses, I think, for her care. And that's going to be difficult to do within a prison setting, because I think she's in a hospital right now. Like I don't think she's in like the jail right now. And then also the risk, and the jury doesn't have to consider this, but in my brain, I'm thinking about like if she's in a regular prison, like she's gonna become a huge target. And so she'll probably have to have like protective custody, like which means more isolation and oh. And I do hope that if for some reason the jury does find her guilty, I do hope that she continues to receive the mental health care and treatment, because she has to live with what she did for the rest of her life. Because I do think she loved your kids. I do think like those pictures of her being a loving mother. Um, and yet at the same time, one day something, and she yeah, there wasn't anything that stopped it. And that's where I want to find, how can we stop it before it gets to this point.
I was doing like some little, rabbit hole searching and whatnot and looking at the place that she's at right now.
Yeah.
And, it's definitely like a state run place. I can't remember if it's owned by the Department of Corrections, but it's definitely like it's part of that.
Mhm.
But there's another place, and I can't remember the name of it now, that's almost like to me, it looks like standard historical northern, like an old hospital, but
Mhm.
it's a prison. And so it's
Mhm.
almost like for situations like her, because I was trying to figure out just what you're talking about, where I'm like, this is going to be so expensive and such a unique situation. Like, how many inmates are in this kind of scenario right here?
Mhm.
And it was almost, and to me, I was like, oh, so this is like a hospital prison lockdown
Mhm.
where, you know, I don't see her going to a like what we're envisioning as like a standard, the
Yeah.
slammer. You know what I'm saying? And then, like you said, let's say she does like for intake, whatever. Yeah, she's going to be in protective custody. She's going to be in this because it's like, what do you do with that? She has to have essentially around the clock care as a standard women's prison or men's prison, whatever, doesn't matter, even set up for that. I mean, I really doubt that.
And there are some prisoners that have, so like the older population, that sometimes they have high medical needs, or even younger, but like I think of it more with some of with older individuals. But the temporary jails, like wherever they hold them temporarily, I don't think they're set up to have somebody with her medical needs. Um, and I do wonder if some of that will enter the jury's mind, that she already has a life sentence, like she already has to live with what she did for the rest of her life. But we've seen other cases where the jury did say guilty. Did you follow Chloe Driver? Did you follow that one?
Was that
Yeah,
the was that the one from Asheville that did that to her baby because the
Georgia.
husband?
Yeah, yeah.
Yeah. Hmm.
Yeah, the culty thing, because
Oh
they
yeah.
had all the mental health experts, and the state in that case didn't even have an expert to refute. Like all the mental health experts were like, yeah, she didn't know. Like they thought that yes, she definitely had a mental health condition, and she didn't really understand what she was doing. But I think her jail calls got her. Some of her post arrest stuff, I think, got her. But yeah.
Yeah, I remember that. That case was wild. And like once her, I don't know what it was, her boyfriend or husband, whoever it was, when all these people surrounding her took the stand, I was like, oh my gosh, this is just a whole bunch of stuff going on here. This is wow. Yeah, that wasn't too far from here, or at least part of it where they were, or whatever.
Yeah.
Yeah, it'll be interesting, and like you said, to see how the jury is interpreting this, because again, it's so unique to be sitting there looking at the defendant in this situation, knowing this, knowing what was done, they have to be thinking, well, these same questions we're asking, well, where is she going to go? What's this going to happen? Why would she just out of the blue do this? Like, it doesn't, like, all these things. But again, we're still very fresh into it. This was supposed to go 6 to 8 weeks. And the judge keeps saying, we're ahead of schedule. We're ahead of schedule. Y'all, we're knocking off at 3 o'clock today. He loves ending that day early, right? But he's like, hey, we're ahead of schedule. So I'm like, okay, well, I guess, we're way ahead or whatever. So now I'm curious, are we talking 4 weeks? Are we close to the state wrapping? I mean, I don't know. It's very interesting how they do courts up north. It's just so different. I like the formality of it.
Yeah.
It feels very proper.
Mhm. Mhm.
So I enjoy that. So is there anything before we wrap things up? Is there anything that like I haven't covered that you're like, oh, Paul, I'm going to talk about this, or anything else going on that you want to mention?
I did just want to mention in her requesting a lawyer, I think that was a good thing for her to do. I do think there are some people on the jury that could view it through the state's lens of she only cared about herself. Because I think that's I think that's the state's narrative. And I don't know if that's the whole picture. Um, because once again, um, like this is a lot, and I really want to hear from the people that have sat down and worked with her. There are tests that you can give somebody to check to see if they're faking symptoms, and uh almost every personality measure. So if she did meet with a forensic psychologist that did psychological testing, there are measures that you can give somebody to see if they're over reporting symptoms, are they under reporting. Like there are validity measures on those tests, and there can sometimes be reasons why somebody flags one of those. But I haven't made up my mind yet. Sometimes I come into cases and I'm like, oh, I know. This is one where I don't have enough information to really make a decision. I'm not fully bought in to the state's version because theirs just denies that she was struggling at all. And it does seem clear that yes, she was struggling. And then I kind of struggle with the defense's side too. And so, but like I don't, I'm somewhere in in the middle. But once those experts come, like we'll have to get back together. I can't wait once we hear from I think the state might call some of her former treating providers, because the defense definitely would, because they're going to be like, you missed it. How could you not? Like you didn't, like the defense is going to go hard at those providers. Those providers also have lawsuits pending because a lot of people got mad over that doctor that started just to say, I can't recall, I don't recall. You know that, like that one doctor that just kind of shut down and was just said, I don't recall. But sometimes when you go to testify, because they were testifying over facts, you don't always bring your record with you. And she could have gotten advice from a lawyer that just said, just answer based on as best you can recall. And if you don't know, just say, I don't recall. Like she might have gotten that advice, but it did make her come off a little. I know a lot of people didn't like her. It didn't rub me completely the wrong way because it was just like, because he could have given her file to so that she could look up the information. But and I don't know if all of them were paid to be there because they're not expert witnesses. They could have like had to cancel their whole day, which that's not fun to have to cancel your day to be in court for like this highly publicized, and now your face is all over YouTube thumbnails.
No, right. That part, YouTube fodder, right? It's just like, I didn't sign up for this. I didn't sign up for this. Yeah, a lot of people didn't like her.
Oh, no.
And yeah, it's just that's what you run into when the defense, the state, when they start to kind of like rough up a witness and whatnot a little bit and get a little hard with them, it rubs people the wrong way. And then the witness comes off that way. And yeah, all the things like, yeah, definitely once the experts come out and these people start rolling out, would love to have you back on and do another conversation, because that's, like you said, that's going to be the heart of this, really, is to hear these explanations from that and the people that treated her, to get just more of that information to tell us why. I'm the same as you. I'm sitting in the middle of the fence and just looking at each thing or whatever and going along and taking it all in. Because usually these cases that we follow, it's almost absurdly over the top, so obvious what took place. Sarah Boone, Brian Walsh, these like just right over the top. This is such a unique case on so many levels. So I've been like really enjoyed legally, psychologically, however you say that word, looking at it in that way. Pardon me. Well, again, thank you, Dr. Barry, for taking time out of your very busy schedule. And thank you, Psych Nerds, for coming over and hanging out. And thank you, Sova Squad, for coming over and hanging out, and all the mods for being here. And yeah, we'll stay tuned. We'll stay in touch. We'll get you back over here once we get some more of that. We can pick it apart and talk about it and all the things.
Awesome.
All right. We all take care, everybody. We will see you tomorrow.